Welcome to the NSWOCC and the Wound Ostomy and Continence Institute continuing education webinar on Curve Fit for curved areas, reviewing clinical cases on SenSura Mio Concave. We would like to thank Coloplast for their partnership in developing this educational event. And now I would like to turn things over to Natalie Kameka, who is an NSWOC and clinical consultant in chronic care for Coloplast. Natalie, over to you.
Thank you, Kathy. Hello, everyone. By way of introduction, again, my name is Natalie Kameka, and I am the clinical consultant for the area of chronic care at Coloplast. I'm also a nurse specializing in wound ostomy and continence. I am very pleased to be with you this evening to talk about an area that is often a challenge for clinicians, providing a curved fit for curved areas. Diane St-Cyr will be reviewing a series of clinical cases on SenSura Mio Concave. I would also now like to take a moment to recognize all of you taking the time out of your very busy schedules to prioritize learning about ostomy care and to advance your clinical practice. I know this pandemic has likely been very hard on you, especially for those clinicians who are on the front lines. And I hope this presentation today will bring an abundance of solutions to add to your clinical toolkit and provide new offerings to your patients. If you could just take a moment to review our disclosure. Now it is my pleasure to introduce to you Diane St-Cyr. Diane is a nurse specializing in wound ostomy and continence care, and she has been a nurse in this specialty since 1986. She also has a master's degree in adult education. She has been an active contributor to the field of nursing, and this is evidenced by authoring many scientific articles as well as chapters in nursing textbooks. She continues to empower clinicians by running educational workshops across the province of Quebec and works as a private consultant in the area of ostomy and wound care. It has been a pleasure to work with Diane and introduce her today to review clinical cases on SenSura Mio Concave. Without further ado, I'm going to pass it over to Diane.
Thank you, Natalie, for this introduction. So let's start with the objective of this session. So at the end of the conference, you will be able to review how Peristomal Body Profile Terminology can apply. Can I just move this? Yeah, sorry, I couldn't see my slide, sorry. Can be applied in selecting a concave shape barrier for your patient. Understand the specialized feature of SenSura Mio Concave that are designed to fit curves and bulges. And finally, to gain insights from expert clinicians on application of SenSura Mio Concave using clinical case studies. Many ostomy patients experience complications postoperatively and further in time with their ostomy. The Ostomy Life Study included over 1,200 Canadians. It reported that 78% of individuals living with an ostomy have experienced leakage in the last month. It creates the damaging cycle of leakage leading to skin issues, with 56% of people with an ostomy experiencing moderate peristomal problem. It's no wonder that 31% of people with an ostomy limit their social activity due to their fear of leakage. So, what is the solution to tackle the cycle of leakage and skin issues? The answer is achieving the right fit, as it is the most critical prevention and treatment strategy. Coloplast's approach to preventing the cycle of leakage and skin issues is focusing on fit-to-body solution. A global nurse consensus involving over 2,000 nurse clinicians specialized in ostomy care from 27 countries agreed that assessment of the peristomal body profile is key to selecting the right product solution to meet the unique needs of a person with an ostomy. As you can see on Kevin's picture, he has an outward body profile and he's using SenSura Mio Concave system. I will now present to you a Coloplast validated and evidence-based peristomal body profile assessment tool that can assist clinicians and those living with an ostomy to identify the right products for the ideal fit. Please note that this tool is available on Coloplast's website under the name of BodyCheck. So let's look at the 7 parameters of this tool. The first is the form of the area around the stoma. So there are 3 body profiles. First, the regular profile, the inward profile, when the skin sinks into the abdomen, creating a hollow area, and finally, the outward profile, which is of interest today. The second parameter is to select if the shape is uniform or variable under the area covered by the skin barrier. Third, we need to check the firmness or softness of the abdomen because it may induce some problem when using, for example, a convexity. It could lead to a pressure injury. Then you look at the area searching for creases. If there are creases and fold, you need to determine if they're superficial or if they are deep. Fifth is the location of the stoma with regards of the bending line. So it can be above the bending line, at the bending line, or under the bending line. Then you look at the position of the stoma opening. It is important to note that although some stoma may seem to have a good protrusion, sometimes the lumen of the stoma may be off-centered and could be at skin level or even under skin level or at skin level. Finally, you will look at the type of output, looking if it's thick or liquid stool or if it's urine. So the 7 questions have led the development of 648 peristomal body profile combination in order to meet the needs of all your patient profile. There are 3 peristomal body profile outlined from the nurse consensus. First, you have for 44% of the ostomy population, which have a regular profile, namely the area is level with the abdomen. 20% of patients have an inward profile with an area that sinks into the abdomen. And finally, the outward profile accounts for 36%, and it means that the area rises from the abdomen. So for each profile, you have a solution with the SenSura Mio. So for the regular profile, the SenSura Mio flat is adequate. For the inward profile, the Mio Convex is the good pick. And finally, for the outward profile, the best fit is the Mio Concave. It's important to note that 75% of persons are discharged from a hospital after their ostomy surgery with a flat skin barrier, which can be the best fit for all patients since 20 plus 36 accounts for 56% of a individual that will not have the profile, the barrier that will match their body profile. I'm going to now present another tool of Coloplast. It's the SenSura Mio decision wheel. That can guide you to determine which ostomy appliance is more appropriate for each person. For instance, you can see that the concave skin barrier flange on this example is appropriate for those with an outward profile, with a stoma opening above the skin level, with thick or liquid stool. It is also appropriate for an outward profile with a stoma opening at the level of the skin, but with this situation, the patient would have to have thick stool to use the concave. It's also available on the Coloplast website. There are 4 main causes of an outward peristomal area. First is an excess of fat around the stoma that creates an outward profile. Second, the false hernia. The peristomal area turns outward due to pressure of the inside the abdomen in combination with a weak abdominal wall. When lying down, the bulge reduces. Third is a sliding hernia. It is a segment of intestine that was used to construct the ostomy that loops under the skin, causing an outward profile. Again, when the patient lies down, the pressure of the abdomen reduces, and often the intestine slides back into place inside the abdomen. And finally, you have the through hernia. For this type of hernia, it's loops of the intestine that did not create the stoma that are pushed through the abdominal wall besides the stoma and bends under the skin. When lying down, the pressure reduces and the intestine might slide back again, or part of it might slide back. A survey was conducted in Denmark in 2017, including more than 5,000 individuals with either an ileostomy or a colostomy. The incidence of peristomal bulging was already 24% after only 200 days following surgery, and it increased to 36% after 400 days. Peristomal bulging is also associated with different conditions and items like having a colostomy, male gender, increased age, alcohol consumption, and etc. The body fit technology is the foundation for getting the right fit. This technology is built on an elastic adhesive technology that is unique to SenSura Mio appliances. It provides secure body contact for protection and a flexible fit during movement. Many challenges are associated with an outward profile. Let's look at the first challenge. On curved area, a flat base plate does not fit without forming creases and fold. So the solution is a curved star-shaped base plate. It fits snugly and securely over curves and bulges. The petal of the curved star shape hug the body with significantly less creasing and folding. Next, the second challenge is that the peristomal area changes when the body moves. There is a built-in stability ring, and that ring stabilizes the center zone to the peristomal area so it gets the necessary support. The ring also guides where to put the pressure while fitting the flange on the patient. Challenge number 3 is that outward curve move a lot. The base plate needs to stay secure. The fit zone are at the center provides flexibility close to the stoma, right at the base of the stoma, at the mucocutaneous junction. The fit zone on the outer rim grip down on the belly and follow its movement. It is now time to review some case study of my clinical practice and of the clinical practice of my colleagues, Daniel Gilbert and Isabelle Diane. Case study number 1 is about a 36-year-old female who had irritable bowel with a rectal prolapse with nerve damage. She underwent reconstructive surgery in 2004, and following surgery, she developed fecal incontinence. In 2008, an end-loop colostomy was created. I want to talk a little bit about this type of ostomy because it is not often, it's done in some clinical setting, but not in all settings. So it differs from a true loop. A true loop, you have on the posterior end of the bowel, it's not completely separated. When you are constructing, when the surgeon is creating an end loop stoma, he cuts in two portions, the part of intestine that will be used to create the stoma. He will mature the proximal loop, and the distal end will be almost closed, and it's going to be stitched under skin level with just a small opening that will allow for mucus discharge. This patient had very sensitive skin and had multiple adhesive intolerance in the past. She was wearing a two-piece SenSura Mio Click system with light convexity skin barrier. She was using several accessories of the Brava line, namely the adhesive remover, the skin barrier wipes, the ostomy powder as needed, and the ostomy strip paste, and from time to time, a belt. She contracted COVID-19. Due to heavy coughing, she then developed a peristomal hernia. She was getting a maximum wear time of 4 days. Since a long-lasting heat wave last summer, her skin deteriorated and her wear time decreased to 2-3 days. The contour of the skin barrier tended to lose its adhesion. The peristomal skin was showing a diffuse erythema at the mucocutaneous junction, and she also developed a fungal rash at the edge of the skin barrier. So the treatment I applied for this patient was to apply an antifungal powder on the lesions, brush off the excess, and fix the powder with Brava skin barrier wipe. And I repeated the powder and the wipe, the skin barrier, for a second layer. I selected a two-piece SenSura Mio Click system with a concave cut-to-fit skin barrier. I used a Brava strip base, and I added a Mio belt. When you center the opening well around the stoma, you must be careful with an end loop stoma to ensure that the opening, the distal opening at the base of the stoma here that is discharging mucus is not covered, because it could cause leakage very, very quickly after the application of the flange. I then apply circular pressure all around the inside flange to secure the fit and ensure a great snug fit. The peristomal skin status improved, as well as the wear time that increased to 4 or 5 days. She noted several improvements wearing the new ostomy system. She said that it was more flexible, she was more comfortable, it was easier to apply, and she had an increased feeling of security with this system. So the patient adopted this new ostomy system. As you can see as well, it really follows well the outward profile on the picture, And you can also see that the rash is gone and the diffuse erythema has lessened as well. His study number 2 is about a 36-year-old male who sustained multiple traumatic injury in a high-velocity motorcycle accident. He was put in an induced coma for 2 months, and he sustained intestinal perforation requiring a Hartmann's procedure with a temporary loop colostomy with form stool. Since discharge, he had a significant weight gain. He had a bulging abdomen with a peristomal hernia. He was wearing a 2-piece SenSura Mio system with a cut-to-fit light convex skin barrier. His wear time was 4 days, and he used to change the barrier if there was leakage. On examination, 2 pressure injuries of the peristomal area were found. Lesion number 1 was covered 100% with slough, and it measured 1.2 by 1.2 by 0.2 centimeter deep. Lesion number 2 was covered with 90% of slough and 10% of granulation tissue, and the size was 3.5 by 1 by 0.2 deep. So, there was moderate serous exudate from the pressure injuries, and Danielle selected the following treatment. She applied Brava stoma powder, and she fixed it with medical adhesive. She covered the wounds with pieces of Brava protective sheet, which is a type of hydrocolloid. She then decided to try the SenSura Mio Click 2-piece system with a concave cut-to-fit skin barrier. The patient accepted to test the new ostomy system, and after only 5 days, there was a decrease in the peristomal erythema. There was also an improvement in the size of the pressure injury, and upon removal after 5 days, there were no signs of leakage of the concave system. He finally improved his wear time to 6-7 days. This patient voiced an increased sense of security. He was more comfortable. The erythema resolved. It promoted healing of the wounds by removing the pressure caused by the convexity, and healing was achieved in only 4 weeks. You can see a nice, clean wound bed and new zone of epithelialization all around the wounds. Case number 3 is a 63-year-old man with rectal cancer who underwent abdominoperineal resection of the rectum with a permanent terminal colostomy with pasty stool. His wear time is 4 to 5 days, and he was experiencing frequent itching. The patient was also fearful during physical exertion at work or during exercise. He was afraid that his pouching system would leak. Ooh. I goofed. My gosh. I clicked on the wrong icon. I'm so sorry. Coming back to this case study. He was wearing a 2-piece SenSura Mio Click, flat, cut-to-fit skin barrier. He noticed that folds would form on the contour of the skin barrier, and he was wearing a closed pouch. He was also adding some stoma paste. The patient agrees to try the SenSura Mio Click 2-piece system with a concave cut-to-fit skin barrier with stoma paste and a closed pouch. The patient felt he was getting a better fit of the skin barrier since it followed very well the curve of the abdomen, as you can see on this picture. The wear time was now 5 days, He had decreased itching sensation, an increased sense of security, and he was more confident during physical activities. He was much more comfortable during movement with the concave skin barrier since it's more flexible. Case number 4 is about a 34-year-old male with ulcerative colitis who underwent total colectomy in 2017. He is now awaiting for a proctectomy because at the time of the initial surgery, he was too sick to have that part of the surgery. He has a permanent terminal ileostomy that is above skin level. He developed a peristomal hernia, and surgical repair of the hernia is planned at the same time of the proctectomy. He was wearing a 2-piece appliance from another company with a protective ring. He used to have 5-6 days as a wear time, but in the last 3 weeks, he has been leaking every 2-3 days. The patient reported at the first visit with me that he had developed at that time a wound at 10 o'clock in the peristomal area. He explained that he was wearing a tight band all around the abdomen to compress the peristomal hernia when at work to hide the outward profile. He then stopped wearing the band and the wound finally healed. I selected a 2-piece SenSura Mio Click system with a concave cut-to-fit skin barrier, strip paste, and a belt. I then planned a follow-up visit a few weeks later to reassess the patient with this new ostomy system. As you can see on the picture, the curved shape star is really following very well the body profile. His skin improved, the scar tissue of the wound got lighter color and more mature, and the patient reported improvement in the ability of the skin barrier to prevent leakage. It fit right around the stoma. It had an increased flexibility of the skin barrier during movement, and he had an increased feeling of security. The patient decided to adopt this new ostomy system. Case study number 5 is a 76-year-old woman with rectal cancer who underwent abdominoperineal resection of the rectum with a permanent terminal colostomy with pasty stool. Her wear time was 5 days, but there was infiltration at the base of the skin barrier. To describe the peristomal condition, there were some erythema, there were papules, and there was a denuded area at the lower edge of the flange. She was wearing a 2-piece system of another company with a cut-to-fit flat skin barrier with a drainable pouch, plus she was adding an extended wear ring. So Danielle decided to treat the peristomal skin, applying a cortisone cream of 0.5%, and the wear time, and it improved after only 5 days of treatment. Danielle decided to suggest a trial with the SenSura Mio Click 2-piece system with a concave cut-to-fit skin barrier and a drainable pouch. The concave skin barrier provides a better fit, follows the curve of the abdomen, improved their wear time to 5-7 days, and there was resolution of the erythema, papules, and the denudement area of the skin healed. The patient had an improved comfort, and she had an increased sense of security. Case study number 6 is about a 56-year-old man who had a perforated diverticulitis requiring Hartmann's procedure with a temporary terminal colostomy with pasty stool. This patient is waiting for cardiac surgery, causing him to have restriction in his physical activity level, causing him a weight gain since the ostomy surgery, causing an increased size of both the stoma and the size of the bulge. He was wearing a one-piece SenSura Mio flat, cut-to-fit skin barrier. The wear time was 4 days, and he used to change only if he experienced burning sensation or leakage. Let's look at the peristomal skin condition. There was some contact dermatitis, and there were 2 granuloma present at the mucocutaneous junction. Isabelle treated this with silver nitrate stick, and she applied stoma powder. He also had a feeling of tightness under his skin barrier, and he was uncomfortable in some position. The patient was quite reluctant to change. So after a lot of discussion and explanation with Isabelle, the patient agrees to try a new appliance. She selected a SenSura Mio one-piece with a concave cut-to-fit skin barrier. His wear time increased to 5 days, and there was a better fit with SenSura Mio one-piece concave. The skin barrier follows the shape of the abdomen very well, as you can see on this picture. The patient is comfortable, and the feeling of tightness finally disappeared. It is now time for me to pass it on to Natalie so she can present you interesting products being launched.
Thank you, Diane, for presenting those very insightful case studies, and you're seamless with the technology. So we know technology doesn't always work perfectly, but you made it appear like no big deal. So awesome work. So if you can recall from the beginning of the presentation, there are about 36% of Canadians that have an outward peristomal body profile. And in these patients, a concave-shaped barrier may be suitable. With the new Brava protective ring convex, and when you combine that ring with the concave, there is now a solution designed for people with an outward peristomal body profile that now we can meet all of their needs or most of their needs. So with the convex ring, concave is now indicated for those with not only a protruding stoma, a flush stoma with thick stool, but also those with a flush stoma who may have liquid output, and also an inward stoma that may have liquid or thick stool. So we might often see liquid effluent in those with ileostomies or urostomies. So the convex ring, and when it's applied with our concave shaped barrier, there has been shown to get about 99% skin contact. And as we increase that skin contact with our barrier and the skin, that may help prevent leakage. Next slide, please. So the convex ring is unique in that it is comprised of 2 layers. The first layer, in contact with the peristomal skin, is as seen at the top, is made up of the same material as the Brava protective ring, which is skin friendly, it absorbs moisture, and it helps maintain healthy skin pH. The outer layer, so that's seen on the bottom there, is erosion resistant. It is made of the same material of SenSura Mio base plates. So that way, when it is in contact, perhaps with the effluent coming out of the stoma, it's less likely to break down and disintegrate and not do and maintain its integrity to do the job it's meant to do. So this product, this convex ring, It also can be used in combination with a flat barrier as well. So you can get that customizable convexity. Next slide, please. So this webinar will be presented again in the French language by Isabelle Dion and Danielle Gibert, who had some cases that Diane presented today. And that webinar will be on October 5th from 7 to 8 p.m. Eastern Standard Time. So please check LinkedIn or contact your local Coloplast rep to receive this invitation and sign up. And actually, I will put this link in the chat as well if anyone would like to check it out or share with anyone. And now we can take some time for some question and answers. So if you can please put your questions in the chat box, and then Kathy will help us get those questions out there to either myself or the clinicians. Thank you very much.
Thank you, Natalie, and thank you, Diane, for a very informative presentation. And there have been questions that have come in, and I will start directing these questions. And if you do have any other questions, please type them into the Q&A box in the bottom right-hand area of the screen. So the first question is for Diane. In case study number 4, did you use a hernia belt with these hernias that you saw? So it was case study number 4.
So at the moment, because he just healed pressure injury, we suspend the use of any belt for the time being. But and he's supposed to get surgery within a few weeks. So because he had no insurance, and he had no pain really induced by the hernia, that we could wait. However, once the hernia is repaired, we will definitely use a preventing garment for hernia support to prevent reoccurrence of the hernia.
Okay, thank you, Diane. There is a comment. One of the comments is that they wish the one piece came in a deep convexity. I don't know if that's something, Natalie, that your company's working on, but that definitely is a comment here.
Yes, we actually do have the deep convex in a one piece. And we also have pre-cut one-piece deep convex in both transparent and opaque with an inspection window. So if you'd like, there is a product guide on the Coloplast.ca website. You can get access to see everything that Coloplast offers. And if you have any further questions, feel free to reach out to your local territory manager. But we do have that product available.
Yeah, and the person that made that comment said that she was talking about deep convexity with the star shape.
Oh yes. So with the convex ring, because concave is it doesn't have a convexity to it, just the way that it's engineered to kind of grip around and conform to that outward peristomal area. We instead have created the convex ring to be able to create that customizable convexity so that you can now use concave with inward stomas, flush stomas with different types of effluent. But thanks for your comment.
Okay, and this is a question for Diane. Do you recommend any film between peristomal skin and the base plate or not?
In case number 1, you could see that she was using several accessories. My usual approach is to use the less possible accessories, but because of her skin sensitivity, she was sweating often, so it helped the adherence and it protected the skin from contact with some parts of the adhesive that she was reacting to. But on a general approach, I don't commonly use skin barrier wipes or a spray. I customize it with each patient need.
Okay. The next question is around, sometimes it's difficult to get the pouch to attach to the wafer with the MioClick on a soft abdomen. Do you have any recommendations, Diane?
Well, I sort of asked the patient to do sort of like a Valsalva maneuver to harden their stomach. For some patients, the other trick is that they could choose to adapt the pouch before applying it and using the inspection area to center it or to sort of use it as a one piece. Thus, having the option to open the pouch, change the pouch after a couple of days, and etc. So that's another solution.
Okay, and Natalie, do you have anything to add to that?
Yeah, often some clinicians find it helpful to warm up using their body heat, warm up the appliance maybe in their arm, just like with any base plate that's hydrocolloid based. It just kind of helps activate the adhesive so it flows better into those creases and channels when you do apply it. And then when you do apply it, making sure you run your finger along the center, kind of around the stoma, just to kind of press everything in, and then kind of going outwards like you're drawing kind of like a sun, and then make sure you smooth out all the area of the adhesive to allow it to really adhere and stick. And I know in my practice, I've told people just to lie flat or sit still for 5 minutes, let everything kind of stick before you get up and start moving and bending and I find that usually helps. Also making sure the skin is really dry before you apply your appliance. That can make a big difference. And thinking about if there's any residues from any soaps or creams or lotions that might be on the skin impacting the adherence.
Yeah, I might add another trick. For coupling the pouch to the base plate, because I think the difficulty when the abdomen is soft, it's that it just sinks as you're pressing to click the pouch on the base plate, it just sinks in the abdomen. Another trick I used is to lubricate sort of with either a drop of liquid soap and to apply it on the ring on the base plate before I try to click the pouch onto the base plate.
I'll just add one more thing. Another thing, if it's really challenging to, that mechanical coupling is really challenging on that soft abdomen, you could consider another two-piece option, such as the SenSura Mio Flex, which is a adhesive coupling mechanism. And sorry, I thought you meant getting the barrier to stick to the skin, but now I realize you meant to stick the pouch to the barrier. So yeah, there is also the Flex, which is really a great option, especially for those with poor hand dexterity, that find those mechanical coupling mechanisms quite challenging.
But if I'm not mistaken, I don't believe that the concave is yet available in the Flex version.
No, the concave is only available as mechanical coupling or a one piece. For other two-piece options, we have the Flex.
Okay, so
thanks, Diane.
We have another question. This is for Diane. Case number 4 again. Would it not have been better to use the one-piece concave instead of the two-piece because it appears like the stoma had a bit of a prolapse?
Well, I don't think it's considered as a prolapse because the length of the stoma is stable. It doesn't come down when lying or pushing on it. And there was never any injuries of the posterior wall of the stoma. And the patient did not want a one piece. He's young, he's sort of burping the pouch from time to time when needed. So he didn't want to consider a one piece option. Perhaps in time he might, but at the moment it was perhaps too much change. We have some time to go step by step, but I agree that it could be eventually an option, especially if he's wearing a hernia prevention garment, which could be quite tight to the body.
Thank you. And this is for Natalie. Is the price of your products comparative to other companies? And are there any programs available to assist patients with the costs of these products?
Okay, that's a great question. With regards to pricing of products, I would recommend that they are comparable, but if you would like, specific prices, to contact your local territory manager. And sorry, what was the other part of the question?
Are there any programs available to assist patients with the costs of the products?
Yeah, so actually, if you contact our care program, Coloplast Care, the contact information is on the website. They can walk you through either as the clinician or as the patient with the ostomy. They can discuss some different programs, reimbursement, funding. There's the assistive devices program. There's other things like the disability tax credit available for those with an ostomy, as well as other reimbursement programs. So the care program is a great resource, and there is some information on the website as well.
Right. And also on the NSWOCC website, we did do a webinar just on ostomy reimbursement programs. And there is a recording of that presentation that you can access through NSWOC.ca. And it really varies province by province. And then there are some national or federal programs, and all of them are contained in that presentation.
Yeah.
Someone wanted to know if the slides from this evening would be available to keep for future reference.
That would be a good question. As far as I know, the answer to that would be no. However, there will be, this presentation is recorded and will be posted on the NSWOC website under the webinar series, as well as on the NSWOC Facebook page as well. So you will have access to this presentation, but unfortunately, we're not going to be handing out the slide deck.
Okay. This question is for Diane. What is the most common peristomal skin complication?
I would say contact dermatitis. And often it's because the patient are not fitted adequately. According to their body profile. A lot of patients have a inward profile and they're wearing a flat appliance. And another frequent cause of contact dermatitis is that when patients start the cycle of leakage and skin issue, as a reflex, a lot of patients, family members, and also sometimes non-specialized clinician will have the reflex of reducing the size of the stoma opening on the skin barrier. And by doing such, instead of sticking right on a dry skin surface, they are in fact trying to stick the skin barrier on the edge of the moist stoma, so it increases the cycle of leakage and skin issues.
Okay, thank you. The next question I'm going to direct to Natalie. Is it possible to have samples for teaching purpose for the nursing team or samples to use as trials for patients?
If you want to do any samples for trials or evaluations, absolutely, we can get samples as well as for teaching. So again, I would just direct you to your local Coloplast territory manager and reach out to them if you need any supplies for any of those purposes. We can provide samples.
Okay, thank you.
You're
And here's an interesting question. What about using a hair dryer to the flange or Brava ring prior to application? Diane.
Well, it is known that warming the surface will increase the tackiness and the intake of the adherents. I mean, some patients have done it, I know, and some patients report they had good results. Is it always necessary? I don't think so, but I would sort of encourage patients to, after they apply the barrier, like Natalie was saying earlier on, to apply pressure on the edge right around the stoma first, and then to put the hands on the outer barrier to provide warmth and to give some pressure to enhance the quick intake of the adhesion, and to stay quiet for a few minutes, you know.
And I would just say exercise caution using a hairdryer, because not all hair dryers are created equally, and some might get really hot and you don't want to really heat up that appliance and then put that directly on your skin and potentially cause a burn. So our stance wouldn't be to recommend a hairdryer, but I know it happens. Using body heat is definitely a lot more safer.
Yeah.
Okay, thank you.
You don't want the skin barrier to start melting.
Yes.
Very good point. This question is for Natalie. Is the convex ring available now?
It will be available shortly in October 1st.
Oh.
Yeah, I just got the date.
Great.
October 1st, and it will be available in 6 different sizes. The nice thing about it is you can mold it into oval. So for those, loop ostomies or oval shaped ostomies, it's really, really great. It will come in 6 different sizes, from 20 to 40 millimeter. And if they want any samples, they can, again, contact their local territory manager.
Okay, thank you.
You're welcome.
This goes to Diane. How did the concave adhere with the hydrocortisone cream application?
Usually, it's not a problem. It's Daniel's case, but I do, from time to time, use some cream. So what's important is to have a delay. A trick that the dermatologist shared with us at the conference was to put the cream and then to put either a moist towel or gauzes over the cream to accelerate the penetration of the cream. After most of the cream has had time with massaging also and the compress, you can remove the excess cream. And it's important to mention that it is not an ointment, which an ointment would be Vaseline-based, petrolatum-based. A cream is a water-based cream. So it's quite easy to just remove the excess and just wipe it down so it is not, it's not moist or it doesn't have a slippery feeling.
Okay. There's a comment here. It says, having a colostomy with a retracting stoma, I have switched to deep convexity closed one piece with no accessories, and it's been a game changer. I think this would benefit a lot of people with colostomies. Maybe recommend it to more people. That was
That's great. It's always nice to hear those success stories. So
But
thanks for sharing.
as mentioned, it's today we were more discussing the outward profile, not the inward profile. But I totally agree that with colostomy, I think there might be a little excessive use of accessories. And for patient, it makes a big difference. It's simple, it's quick, and it just sometimes works better with no accessory. So I think we need, as clinician, to customize really the use of accessory case by case. And thank you for sharing your experience.
Okay, and we have another comment here. I have a client with a double barrel stoma, ileostomy, and ileal conduit. So very liquid output draining into the same pouch, and I use the concave. There's a large peristomal hernia. It works better than any other appliance we have trialed so far. For him, has anyone else used the concave for stomas with liquid effluent? So Diane?
Maybe I missed a little bit of the story, because the concave is okay when the stoma opening is above the skin level with liquid output. So maybe I missed that line in the story, Kathy?
Yeah, so double barrel stoma, ileostomy and ileal conduit. So very liquid output draining into the same pouch, and they use the concave.
But it didn't mention if the stoma had a protrusion, because with the concave, you can have liquid output. At the moment, what is recommended, it's for an above skin level stoma when we're talking about liquid. But now with the convex ring, perhaps it's going to be now possible to use it with more liquid.
Okay.
Because I've used it with liquid output as long as there was a protrusion.
Okay.
If they are finding, if I may add, like if they're finding challenges with the liquid output and it's kind of more of a flush stoma or slightly retracted stoma, then that convex ring might be a great option to consider.
Yeah.
And then the next question is, what's the best way of applying the concave appliance? And I guess I'll direct that to you, Diane.
Well, it's the same way as any other barrier. Usually for a person that's self-caring for the ostomy, I usually recommend standing or sitting up straight, at least to be in a position where the creases or challenges are present. And then I like to also stretch the skin, so the skin is stretched, and to then, as I mentioned, to really press right around the mucocutaneous junction to allow for a quick intake of the adhesive.
Okay. Natalie, will the convex ring be a soft convex?
I would say that the convex ring, when combined with the concave or a flat base plate, would be equivalent to a soft convex. Yes.
I agree.
Yes.
Okay.
I wanted to add, we also, in the chat, there's some links to instructions for use. I know someone was asking about how to apply it, and another thing to mention is that flip, when you put it on, you just have to flip the petals down and they will conform around that outward area. But we do have some IFUs in the chat for you if you're interested.
Excellent. Do you have any suggestions for those who don't fall into one category? For example, the peristomal bulge only affects one side of the stoma, while the other side sits flat or even dips. I have had good success with the concave when the bulging is symmetrical, but still struggle for these cases where you're fighting two opposing forces in such small proximity.
Yeah.
Any?
Yes, I had experiences with that. And what worked for that patient, for those patients, is that sometimes I can use a part of a ring. I don't use a full ring. I may use a third or a quarter or half of a protective ring to fill the depression on the side that is not bulging. And that helps to even out the surface so the concave can work better.
Okay. And getting back to the previous question we had on hydrocortisone, someone has asked, have you ever trialed a hydrocortisone inhaler in severe cases?
Yes, yes, definitely. But sometimes the cortisone cream has a higher concentration because there's many creams on that you can that I can prescribe. So yes, the answer is definitely yes, but
okay, so we're at 8 o'clock now. Diane, do you have any last comments as we wrap up?
Well, it's been really a great opportunity to share with so many clinicians my experience and our experience, because Danielle and Isabel cases were also great. And I think it's a nice option. It's an additional options to consider for those patients falling into the outward body profile.
Okay, thank you. And Natalie, any last comment?
I just wanted to say it's been excellent working with Diane and Isabel and Danielle, that they've brought these great cases today to you, so that, you know, to give you some more tools for your clinical toolkit. And hopefully you've learned something new today. And feel free to check out the website or contact your TM if you have any further questions that weren't answered for you today.
Okay.
Thank you very much.
And thank you to both Diane and to Natalie for their presentations. They've been very informative, very educational, great discussion. And again, thank you to Coloplast for your partnership with NSWOCC on this educational webinar. So all of you will be receiving a follow-up email with the webinar recording, and we thank you for taking the time out of your busy schedules to participate in this continuing educational session. Thank you and good night.
Thank you, Kathy.
Thank you. Good evening.